caries. First issue is methods of examination. All methods during examination are divided in two groups, two main groups. First group is basic or main methods, and the second one is additional methods of examination. First group, basic methods, includes several methods. First, interview, which consists of complaints, anamnesis morbi or history of disease, and anamnesis vitae or history of life. Number 2 is inspection. Number 3 is probing. 4, percussion. And the last one is palpation. These methods corresponds to basic. First, main big group, basic. And the second big group is additional, which includes thermometry, electro-odontodiagnosis, radiography, vital staining, luminescence, trans-illumination, and laser flowmetry. And now about each of them in detail. First, we start with basic methods. And usually we start our examination with interview with patient. Just speak with patient to find out his complaints. Interview is carried out by questioning the patient, and we have to ask some important questions. For example, what do you think the problem is? Does it hurt too cold or hot? Does it hurt when you chewing? When does it start hurting? How bad is the pain? What type of pain is it? How long does the pain last? Does anything relieve it? How long has it been hurting? And so on. First, we find out complaints. What patient feels? Pain or something like that. And the main complaint in dentistry, in cariology, is pain. And we have some characteristics of pain. To make an accurate diagnosis, dentists are guided by the type of manifestation of pain. The fact of presence of pain, yes or no. Pain may be or without pain. Causality, it may be without reasons. It is called spontaneous pain or spontaneously. Or causative, when pain appears from some reason. Reasonable. Duration, it may be short-term or long-term, short pain or long pain. Next characteristic is intensity. It may be acute or aching. Acute pain is very strong, aching not so strong. Next, the presence or absence of light gaps. Light means without pain. Next, irradiation. It means pain is given in the ear or neck or head or some another part of head most often. And development in time. This is characteristics of pain. Pain is main symptom in dentistry, in stomatological examination. Next part of interview is anamnesis. During the survey, the doctor finds out the history or course of life and disease, as well as the general well-being of the patient. And first, anamnesis morbi, history of disease, and the purpose of this method is to determine the development of complaints over the time. For example, the nature of pain, acute, aching, weak, strong, the time of occurrence, frequency of attacks and their periodization, factors that contribute to the strengthening and subsiding of pain. Preventive measures were taken by the patient and the way of self-help that the patient provided to himself. And the last part of interview is anamnesis vitae, or history of life. First part of interview is complaints, second anamnesis morbi, and the third anamnesis vitae. This is interview still. The purpose of the life history is to establish the presence of general somatic disease, to find out the some allergy or its history, to find out the conditions of life, work, region of residence, to identify a deficit of fluoride, for example, to learn the patient's diet, especially during teething and bite changes, and to detect the features of the chewing process. Next method, number 2 in basic group, is inspection. And first we assess the general status. Assessment of general status of patient. Visual assessment of the physical and emotional state. It may be satisfactory or unsatisfactory, caused by pain, poor sleep, loss of appetite, and so on. And more detailed assessment of local status. We start with an external inspection of the Maxill facial region. First, configuration of the face. It may be normally the face symmetrical and proportional. Next, view skin color, palpation, and some other characteristics. Usually it's in normal healthy patient, it's normal skin, pale pink color, clean, easy to fold. Next we assess red border of the lips and also visible mucous membranes. The nature of closing of the lips, their contour, the presence of scales and crusts, pallor or hyperemia of the visible mucous membrane, and also mouth opening. Normal, it's free. Next, also we estimate conditions of the temporal mandibular joint. Research output of branches of trigeminal nerves. Wales point normal, exist point slightly sensitive but painless. And examination, especially palpation of lymph nodes. lymph nodes of head and neck. Palpation to determine the size, the consistency, some characteristic of surrounding tissue or soreness. Next part of inspection, the examination of the oral cavity. Visual inspection and instrumental examination using a mirror and probe and tweezers. Three main instruments during examination: mirror, probe, tweezers. Examination of the vestibule of oral cavity before teeth. Next, inspection of oral cavity, assessment of dentition, examination of the teeth and each tooth in detail, and assessment of the functional capacity of the seals, if it exists. And during examination of the teeth, we usually estimate. First, we provide visual examination using a mirror and hold sequence, probing or sensing the teeth, percussion, vertical and horizontal, and definition of mobility of teeth. After inspection, we move to the third method, which is called probing, and we use special instrument which is called probe. It is sharp and angular. This is probe, the instrument for probing. Probing allows to identify first defects and changes of the enamel surface, the density of the bottom and walls of the caries cavity, the pain sensitivity of the affected areas, and the depth of the caries cavity. Presence of caries cavity and its characteristic: density, pain, depth. We find out all this using probing and instrument probe. Next method, number 4 from the first basic group, is percussion. Percussion or tapping on the tooth. We tap on the tooth using special instrument. Usually we use tweezers or probe handle to tap the cutting edge or chewing surface of the tooth. It may be vertical. In first picture you can see vertical percussion in vertical direction and horizontal in horizontal direction. And the last method among this group, among basic methods, number 5, is palpation. Palpation is used to determine the consistency, mobility of tissue and organs, and the pain response. Palpation is performed with all fingers of both hands. There are maybe superficial and deep palpation, and also extraoral and intraoral palpation. First perform a superficial palpation, then a deeper one. Deep feelings allows to determine the size, consistency and conditions of lymph nodes, salivary glands and their ducts. Assessment of the functional capacity of the seals. We estimate it during inspection and probing, both inspection and probing. We use probe and mirror and assess anatomical shape, seals, marginal adaptation of fillings to the surrounding hard tissue of the tooth, the state of contact point, state and degree of attraction of the surface, the line color, the color of the tooth, and the presence of secondary caries.